Hi, my name is Dr. Frank Hill. I'm a urologist in Fredericksburg Urology. I'm here to talk about the Latenu single-use cystoscope and flexible cystoscope and flexible ureteroscope. Traditionally, there's several issues that we see with outpatient cystoscopes that I know in our practice we've had issues with, both expense, breakdown, need for cleaning the scopes in between cases, and I think an option like this with a single-use, very inexpensive, and brand new at the time of use scope would be a benefit to urologists. And then also from an inpatient standpoint, there are several situations where I think it would help. The cost of scopes in the operating room is always notoriously an issue. They are exorbitantly expensive to buy them initially and then to get them repaired, to the point where it tends to be almost a financial loss for the hospital because of that. So I think a single use is kind of going to be the standard of care eventually. And I think a scope like this is one that may be in the running for something that would be very popular, both in a private hospital, but also in a military situation or in a more federal system. So I talk about some of the benefits that I see with this scope. The flexibility of it is extremely good. I can kind of show you that a little bit. The tip of the scope pretty much has almost a full range of motion that you would see in a brand new scope. A lot of times when you have a ureteroscope or a cystoscope that's been used for multiple procedures, you get a limited range of motion, something like 90 degrees, or it starts to get kinked. And when you see that, it tends to mean that you're doing a suboptimal procedure. And so when you have a brand new single-use scope like this, it really helps you get a better range of motion in the bladder and be able to see every part of the bladder that you need to see, especially when you're doing something like surveillance for bladder cancer or initial diagnosis of gross hematuria workup. And so I think that's a huge benefit to a single use. This single use is extremely easy to use as well because it's also plugged in to either a computer or a tablet or a smartphone. There's going to be a universal app that you can use with pretty much any system, Google, Android, iPhone. And so when you have that availability, it's going to help you if you're in the office with ease of care and being able to show a patient the results of what's going on. But also if you're in a triage situation, I think that's going to be a big deal when you're out in a military situation and you're requiring an urgent need for a catheter being placed or a scope being used. And so the mobility of this would be extremely helpful. Not to mention the public health benefits that you have of a single-use scope like this when you're going to underserved communities and you need to be doing some diagnostic purposes that just frankly aren't available in certain parts of the country. Even here in Virginia, we have a lack of good rural health care and a lack of urologists, and so it's difficult to get care to the people who need it. And so having a scope like this available where somebody could be going out to a more remote area and using this and putting it into a car and conveniently transferring it somewhere else would be extremely helpful. And so I do think that single use kind of is the wave of the future. We're not going to be seeing people carrying big boxes of big heavy equipment and big lighting anymore coming up, and I think that's why I like the Latenu a lot. There's two different sizes that I think are going to be useful in different situations. The one that I'm holding right here is a 9 French diameter. When you have a 9 French diameter, it does have one access working sheath within it, and that can either be used for irrigation or for putting in a stent or a wire to gain access up into the ureter, to be putting in contrast, for example, or to be putting in a working device such as a biopsy forceps or a grasper to remove a ureteral stent. And so this is kind of like your workhorse. This is the one that's going to be able to do pretty much everything that you need it to do, both in the operating room or in the outpatient setting with minimal discomfort, given how flexible and small it is compared to the typical flexible cystoscopes we see on the market today. The smaller one here is a 6 French. The 6 French is going to be much more of a diagnostic purpose scope because of the tinier size. You can see that it still has a little bit of a very good flexibility to it that you would expect with a brand new scope, which is excellent. That's more than what you would need. The quality of the imaging when we do plug this in is going to be extremely good, and we'll show you that to you as well. But what I like about this is that, patients are not going to be complaining or having much discomfort at all when you're putting in a 6 French scope. I mean, that's significantly smaller than a 22 French, which can be, frankly, pretty uncomfortable. The benefits too, as well, is that actually both of these can also be used in a situation where you do have a patient with a Foley catheter. It doesn't go through every Foley catheter, but there are certain catheters, like the ones that I use frequently for patients with gross hematuria, that have wide open tips, 3-way catheters. And when you have a wide open tip catheter that's either a 22 or a 24 French, both of these catheters will easily go through. And so when you do that, that allows you to have a patient that's at bedside in the ICU, for example, and you can go in quickly and help to determine what the problem is. The benefit as well is that patient, if they have a 3-way catheter, you can also have extra irrigation going in through that catheter to help with your visualization. So for example, I can see, last time I was on call, a patient with gross hematuria came into the ICU, and I had to take them for diagnostic purposes to the operating room. They had already had a 3-way catheter in and was already getting irrigation through that. I could have very easily said, let's just bring the camera in, single use, pop it into my Android phone, and take a quick look in, and sure enough, show that there's no acute bleeding going on, that there was just an old clot that was in there. And I could have saved that patient a trip to the operating room. So just one example of where I think there's just multiple ways to use these scopes that will benefit us pretty much on a day-to-day basis. But yeah, in terms of the military and traumas, we definitely see when people have injuries to their urethras, it's a pretty urgent need for decompression of the bladder. You can do suprapubic catheters if possible, but those are also very difficult and technical. And one of the best ways to preserve urethral function long-term is if you can reconnect a urethra quickly. So if there's any injuries, doing a bedside cystoscopy in the emergency room or in an urgent trauma setting can be difficult. It's very overwhelming to have to bring in a large cysto cart, which is usually involved. It's huge, and everybody has to wheel it down the hallway to get it to the emergency room or the room that you need it in. This would help limit the number of devices that are needed and make it much easier to get a catheter into that patient safely, or at least get a wire in using the 9 French, being able to pass a wire through either a stricture or an injured urethra, whether it's from Foley trauma or gunshot injury, fall, get access to the bladder, and then be able to put a catheter in safely for that patient. And I know that's one of the things that urologists hate the most, is having to do a bedside procedure because of how burdensome that is. And so there's also some other uses too, things that we have to take patients to the operating room for that we wish we really didn't have to do. For example, patients with chronic indwelling stents or who have a very tiny stone that's in their distal ureter, something that you wish you could just take care of in the office setting under minimal anesthesia, whether it's just lidocaine in the bladder with a Urojet or with nitric oxide like a lot of offices have. A scope like this would allow you to do some procedures such as grasping a stent, externalizing it, putting a wire up, and putting a new one in over that said wire. You could also grab a stone with a stone basket, using the stone basket through the 9 French scope. You'd have no problem putting that basket through, grasping it, and then externalizing it. So I think that would significantly reduce the number of anesthetics that are required, especially for these older patients with ureteral strictures and long-term indwelling stents. I know I have several 95-year-old ladies who constantly have to undergo a procedure every 3 to 6 months that I really wish I could do in the outpatient setting. So I think those are the main biggest benefits that I see to this. I think from a billing standpoint, I don't see that much of it as a urologist, but I do know that hospitals and practices and military, they spend tons of money on the cost of scopes. Scopes are exorbitantly expensive, and I know that the cost of this is significantly less. And so a one-time use scope is not getting sent out to be refurbished, and there's no downtime. If it breaks or doesn't work, you just rip open the next one and it works. So it really cuts down on the time to get the things repaired. You always have access to them when you need them. They're always sterilized and ready to go. And I think it's going to be a significant cost saving. And we're seeing that in studies, that single-use scopes, bringing the cost down on them specifically is going to help us long-term with the cost of medical care. I'm going to show a couple of examples here of kind of how this works and the quality of the video here. I'm starting out with a prosthesis here going in through the urethra, and you can see, you know, how when you're in a tight enclosed space like a urethra, there's very high quality light, very easy to see where you are. And just like anything, once you get into a bigger space like a bladder that's filled up, you'll have a little bit of a dark appearance, but you can still see very clearly with very high definition pretty much everything in the bladder in terms of the anatomy. And you can see how much mobility I have here with this scope. It's very sensitive and it allows me to have a very steady hand when I'm doing my procedure. And you can see where you can easily identify something such as a bladder tumor, such as right here. Looking at the ureteral orifices in this prosthesis here, you can see there's a couple. There's one right here and there's one on the other side, right here and right here. And so in terms of access to be able to do something such as a procedure, such as a biopsy or fulguration or placing a stent, would be pretty easy. Now this also allows you to take pictures too for documentation. So once we're in, I can either press the button on the top or save pictures with the access on the app as well. And so when you are able to record, it'll take a picture. It'll then allow you to edit it, put information on there, and do some post-editing so you can explain it to the next person or for documentation purposes. You can have a full range of motion too. If I come in, I can fully retroflex as we do, looking at the bladder and the prostate. In a prostate, you can see I'm looking all the way back on myself here, and I'm getting a full 360 degrees view, which you can see on the video there. And that's important too, because it just means that you can see every aspect of the bladder and make sure that you're not missing anything, which is just really important. You can't do this with a lot of these older flexible cystoscopes that we have. They're just too broken and they need to be repaired. So that's kind of the quality there. You can see how detailed it is, how seamless it is, and the ease of use it is. You can see my mobility here really is pretty impressive. The next thing is that if you wanted to do, for example, let's say you're in a situation where you need to place a ureteral stent, place a ureteral wire, and you either want to do this in the outpatient setting or even in the inpatient setting. You can also cannulate this pretty easily. You can even do it on your own. Anybody who's tried to do this in the emergency room with a large flexible cystoscope knows how difficult it can be. But with sterile gloves on, obviously, I would be placing a Benson wire in, and you can see how easily it will be to advance this in. It goes in very smoothly. It's a little bit longer than a regular cystoscope, but once it's in, you can see very clearly the tip of your stent comes out right at the 6 o'clock position, so it's easier to see where it's coming through. A lot of other scopes come in at an angle, which makes it kind of hard. And then it allows you to aim right at something such as the ureter and then be able to cannulate that and place it upwards, getting access. And so it just allows you to do a lot of things that you would not normally be able to do, and kind of opening up the world of minimally invasive procedures to the outpatient setting that we wouldn't normally have. So just right there as I go. Again, this is not in a situation with some fluid. As I angle, there, I'll be able to cannulate it. Up you go once you get access. You can typically advance it more on your own, and you'd be able to come out. And once you come out with the camera, you'd be able to place a stent over top of that. So just pulling it out. Once you pull out completely, you're out completely. You have access to your stent, to your wire, excuse me, and then you're able to place your stent over top of that. And then you've just placed a catheter, place a stent at the bedside while the patient's still awake, or in the office without requiring any anesthesia. So I think that's one of the benefits. All right, next situation I think that this could potentially be helpful for is a patient already with an indwelling Foley catheter, having something like bleeding or an issue within the bladder. Diagnostic purposes on a patient in the ICU with a catheter already in. You could literally put this in through there without problem if it's a three-way catheter that would likely already be in if somebody is having issues such as hematuria, hence the reason for your consultation. So you would have a catheter already in, the balloon would already be up. You'd have access with a third access point here to place normal saline, sterile water, whatever you want, irrigating in to help you better with your visualization. You could also just instill already in that and then clamp it shut. And so once that's already in there, you can then take the scope and then go through. You'll see it as we go through here. It'll go through the scope, and this is without lubrication. It would be even better if I had lubrication. As you go through, you're through, and then at the very end there, sometimes there's a little bit of a lip that you have to get over. And then once you get in, boom, you're in the bladder. And so the patient would literally feel nothing in terms of discomfort if you already have a catheter in the patient, because that's already protecting their urethra from the camera. You can see that my mobility through there, because the articulating tip is just at the very end, that you have very good range of motion through this catheter. And then you could even show, I'm going to push it in just a little bit more, and I'll do my full flex. A little bit more in. You know, a full flexed scope without any difficulty. The balloon is down currently on this prosthesis, but if you did have it up, you'd be able to see the balloon itself. You can see that I'm fully articulated there, looking back at the bladder neck. So this would be great just for patients with a quick procedure without wanting to hurt them, and then coming back out. Very easy. Very easy. All right, so let's say you've completed your procedure, you've documented everything, you took pictures of lesions that you wanted to show either the patient or just put into the medical record. What you can do next is through the app. It's pretty seamless. Once you click the button to take a picture and save a photo, you can pick it up through the gallery in the bottom left-hand corner. You'll be able to open it back up. Once you get in there and you have your imaging here, if you want to do any after procedure documentation, you can come over, click on this, for example. I'm going to say that looks like a low-grade papillary lesion. I'll just say bladder cancer, or I'll say CIS, carcinoma in situ. You can also change the size of the font. You can really do anything with this to kind of make sure that it cosmetically looks easy to read and easy for somebody who comes in afterwards to look at it. I'm going to think that this is going to look better and show off more if I'm going out with a Nice bright yellow here. There you go. And I can save that there. And then if I really wanted to, if I had a bunch of things on the screen that I wanted to be able to target somebody's attention to, I could also draw a shape around it. So let's say if I wanted to have a rectangle, I could come in here and really document that clearly and then say, oh, actually there's another small lesion that I don't want somebody to forget behind. So then I can draw another one separately in the same picture and then document two separately. Just allows you to have a lot more data. You can save it. If you make any changes and or you wish to edit it a little bit more, you can go back and undo all your changes that you've made.